I'm a medical doctor and working in Lyncheping in Sweden. And I've been in addiction medicine for all my career, actually. But I've actually done my own research on risk behavior for HIV and hepatitis among injecting drug users within the criminal justice system. And that is not the topic that I'll talk on today. But in this research, what we did discover was we were also asking a lot of other questions of our participants, and among other things we were asking about how they got into drug use, and it was quite clear that the majority of the heavy drug users that we interviewed, they started with cannabis, and the median age of introduction into cannabis was 14, and it was over 80% that had started with cannabis. So it's obvious, at least, that cannabis is a gateway drug to heavy use. That doesn't mean, of course, that all youngsters that start with cannabis will also go on to heavy drug use. But I'm a strong proponent of the theory of looking at the spread of addiction as an epidemic. And since if we want to get rid of addiction, we have to look at it in that way. And the starting point, the spread, is among teenagers, and the main drug is cannabis. So I think it's extremely important that we all work together to stop and to prevent teenagers from trying cannabis, and also to early discover if they do. And that's one of the things that I do a lot in my own practice. And what is also very important in this work, that we have to work all together. We need all the actors, the law enforcement, the criminal justice system, healthcare system, social care, parents, teachers, and we all need to get educated about this drug, because the teenagers, they get a lot of information. They read on the internet. They're exposed to enormous amount of pro-drug propaganda in movies and music, etc. So we need to know, we need to be able to argue with them, and we need to feel secure that we know about this, and that we know at least as much as they do. And one of the issues that I have discovered in Sweden, and that's why I'm interested in this subject, is the matter of medical marijuana, because the teenagers often bring this up. They say, okay, well, they use marijuana as medicine in the United States. Well, it can't be that bad. It actually must be healthy, since they use it as medicine. And then we need to know, we need to know how to argue against this among the young people. So that would be, those of you who were here yesterday afternoon will discover that some of what I will be telling you is really a repetition of what Dr. Sadet told it in his excellent lecture yesterday. But some of you may not have been here, and some of the things that I will present are also new to you, I hope. So we need to distinguish some concepts here. And the first question I think we need to be able to answer, is cannabis medicine or is it a narcotic drug? You can ask the same question for opium. Is opium medicine or a narcotic drug? Or amphetamine, is that medicine or a narcotic drug? Well, when you think about it, you realize, well, it's both. It has medical effects, and it's also a narcotic drug. So I think one very important distinction is between medicine and a pharmaceutical drug. Is that the same thing? Well, we use them similarly, but of course medicine is a much broader concept. A lot of things are used as medicine. rhinoceros horns are used as medicine towards male impotence. Not very effective, probably, but it's certainly not a pharmaceutical drug. Somehow, we think that medicine is a much broader concept. Pharmaceutical drugs are certainly medicine, but not all medicine are pharmaceutical drugs. And pharmaceutical drugs, when we think about it, we realize this is a modern concept. It has something to do with control and efficiency and so forth. And there is another important distinction, and that is the difference between cannabis, which is, for example, marijuana and hashish, the flowers or the resin from cannabis, and the cannabinoids, which are defined components that you find in cannabis. And actually there are more than 60 cannabinoids in cannabis. But there are also, we also have cannabis in our own, or cannabinoids in our own brain and in the body, like anandamide, which we produce ourselves. And there are also synthetic cannabinoids, like the ones you find in spice. And this picture, Murtha Waters already showed, and shows the similarity between THC and anandamide. And also, there are a large number of cannabinoid receptors in the brain and in the rest of the body as well. So it has tremendous effects, and as Murtha Waters has already shown, it's a very important, the cannabinoid system is very important. It's extremely important during the maturation of the brain and has very much impact on, for example, the memory and learning. So, cannabis as medicine. The first document, it's certainly been used as medicine. Historically, just like opium, cannabis has been with us for almost, actually 5,000 years. And so it has pharmacological effects. For example, on pain, nausea, anorexia, and spasticity. And there is a lot of ongoing research on cannabinoids, and that may come out as good pharmaceuticals in the future. And there already are some, like Marinol and Sativex. And Marinol, as you probably know, that's pure THC, and it has been approved actually already in 1985, and for nausea and chemotherapy and wasting in AIDS. But it's not widely used. And why is that? Well, of course it has limited effect. There are many other more effective pharmaceuticals, and it has side effects. One that was mentioned yesterday also, Sativex, which is a new pharmaceutical. It's a more intelligent design. It's a 50% THC and 50% CBD, as was also mentioned yesterday. Cannabidiol, which has a counter effect on the hallucinogenic effects of THC. And as was also said yesterday, it's almost absent in the cannabis that is used by that is smoked today. And this was approved. Oh, sorry. Then we come to the question: is cannabis or marijuana approved as a pharmaceutical in the United States? Well, what does it take to get approved as a pharmaceutical? There's usually a national agency. In Sweden it's called Läkemedelsverket. In the United States it's called Food and Drug Administration, that approves of pharmaceuticals, and it's a very complicated and extensive process. For example, the substance should be well defined and controlled, and the same amount should contain the same dose. It must be safe and effective. And the mode of administration must be safe. And the substance must be tested on animals and humans in several steps. And the production of the pharmaceutical, of the substance must be controlled. And the profile and side effects must be carefully described. Let's look at cannabis or marijuana. Is it the amount control? Well, it isn't at all. The concentration can vary between 2 and 30%, and it's usually unknown. And there are a number of other substances as well in the cannabis, in the marijuana. And the safety, of course, is very questionable. We've heard a lot about that, both yesterday and today. There are a number of very serious side effects, and I think the most important, dramatic, of course, are the psychiatric, the psychosis, depression and anxiety, etc. There are also somatic side effects, particularly in the lungs, lung cancer, which probably, but not definitely shown. And we know very well now that it is highly addictive. And how about the effect? Well, it's not impressive. It has effect on pain, but it's not a very good effect on pain. It has effect on nausea, and but neither. There are better medication, the better pharmaceuticals on these indications. And how about the mode of administration? Well, smoking. There is no drug in the world, as far as I know, that is approved for taking by smoking. And when you smoke cannabis, because of the way you smoke it and you keep it in the lungs for a long time, you get, in one study they showed you get about 4 times more tar in the lung. And how are there tests on animals and humans? I heard about that. There have been attempts to do good science on testing marijuana smoking, but they have had difficulties getting persons who are willing to attend these studies, because you need to be cannabis naive if you're going to attend in a study like that, because if you are an experienced user, you have developed tolerance to the drug, and most of the participants who are willing to attend in these studies, they are experienced cannabis smokers. So that is a problem when you want to do these studies. And how about the production? Is it safe? Well, in these plantations,